الله الرحمن الرحيم والصلاة والسلام على سيدنا محمد وعلى آله وصحبه. طيب, guys, please, it's one of these long topics that is really tedious صراحة. Shortness of breath والabdominal pain, يعني الديفرنشال حقها سيء وممل ورزيل وطويل. However, this is a good portion of the people you will see. طيب, unfortunately كل الحريم عندهم shortness of breath regardless. كل الحريم بيعانوا من 4 حاجات دائما: shortness of breath, lower back pain, headache, and lower limb edema. الكل. That's a good topic to study صراحة. I don't know. But it's all over the world, it's not just here. طيب, our overview today. We're going to talk about some definitions, signs and symptoms of shortness of breath or dyspnea. We're going to talk about bronchial asthma, COPD, pneumonia, pneumothorax with touch on congestive heart failure. طيب, المشكلة إنه الحاجات هذه it comes and returns, and you see it in every exam of internal medicine, every exam of emergency medicine, fill boards, fill internship, fill residency. It just keeps coming back and back and back. والمشكلة إنها من الحاجات اللي تعتبر اللي يسموها السهل الممتنع. You read it over and over and over again and you still make mistakes. مش انتوا بس كلنا. Okay. So hopefully we're going to make things a little bit simpler. طيب, by definition, who can tell me what dyspnea is? It's shortness of breath. Awareness of shortness of breath. That's probably a little bit more accurate. It's the patient's perception of shortness of breath. Okay? You can have somebody who's satting well, he's fine, he's okay, but they're telling you I'm short of breath. Right? Orthopnea. Shortness of breath on recombinant position or lying down. Okay. END, paroxysmal nocturnal dyspnea. What does paroxysmal mean?
Position.
No. لما الحاجة ما تعرفه تسأل عنها. Yeah, this is what this means. بس سؤالي, what does paroxysmal mean? Paroxysmal means sudden. Okay, so paroxysmal AF is sudden AF. Okay, paroxysmal nocturnal dyspnea, sudden night shortness of breath. Okay, so it's waking up from sleep and feeling short of breath. مين حتعرف هذا؟ Unilateral position. والله كويس, لا في تحسن. Trypopnea is having shortness of breath. لا جاي متأخر. ايش اسمه؟ أول وآخر مرة أحضر بعد ما أبتدي الليكشر. Please don't do that. It's dyspnea when you lie on the right or on the left side. Okay? Okay. So what are the factors that can give you shortness of breath? Obesity. Okay.
Smoking.
مش risk factors for shortness of breath. ايش اللي حيخليكم feel short of breath? Any problems في gas exchange. So if you have a pneumonia, if you have a PE, if you have if you have alveolar hemorrhage, pulmonary edema, okay, anything for circulation. This has to do with gas, this has to do with circulation. So PE, pulmonary hypertension, cardiovascular function, tachyarrhythmia or heart failure. Anything in the mechanics, such as what?
Paralysis of the diaphragm.
Yeah, okay. What else? More common. Well, yeah, kind of, but not quite. You're on the right track. Hyperactive airway disease, which is asthma. Chronic obstructive pulmonary disease, pneumothorax. Very, very common. Okay? أو عندك problem في oxygen carrying capacity. So you have anemia, okay? You don't have enough blood, or you have CO poisoning, or you have methemoglobinemia. وهذه الحاجات هنتكلم عليها إن شاء الله 2 weeks. Toxicology lecture. Okay? Okay. So in triage, I need to ask 4 questions. Number 1, is there a threat to life? Yes or no? Because if there is, I have to act and then look for a cause. Is there any respiratory distress? إذا واحد جالس قدامك, he's fine and talking to you, or he's really tired, and okay, these people, you will basically put your stethoscope and listen to what it sounds like. Is he wheezing? Is there any air exchange? Do you hear anything at all? You might not hear anything at all. Are the vitals normal? If your shortness of breath is severe enough to basically give you abnormal vitals, you're either desatting, whether your blood pressure is low, whether your blood pressure is high, or your heart rate is 160, then it's a problem. Okay? And does the patient need any emergent management right now? Or can he wait? اللي يجي يقول لي عندي shortness of breath and he has a cold, يمكن أقطعه ساعتين في الانتظار. Different from somebody who's gasping. Okay? Okay, so what are the signs of respiratory distress? How do you know that somebody's in respiratory distress? Use of accessory muscles. Because of your breathing? ما فهمت. عادي ما في مشكلة. So? كيف تعرف إنه واحد short of breath? Okay. تكيبني. صح ولا لا؟ Okay, so tachycardia, tachypnea, cyanosis. Okay. Stridor and grunting. قلنا إيش stridorish grunting? كيف تعرف إنه واحد short of breath؟ Okay. تكيبني. صح ولا لا؟ Okay, so tachycardia, tachypnea, cyanosis. Okay. Stridor and grunting. قلنا إيش stridorish grunting?
During inhalation.
So this is signs of upper airway obstruction. Remember? Yeah. Pursed lips. شاطرين فيها الفيميلز مرة. What's pursed lips breathing? This is pursed lips. تبغى تمص الشفايف؟ وردة? This is basically what they're doing is they're breathing and they're trying to get the air out, but they don't want to make a big opening in the mouth so that you get backflow. You're breathing under a closed opening, so you get backflow to keep your alveolus open. So when you breathe, you're keeping most of the air in to keep your lungs open. We're going to talk about this later. Nasal flaring, usually you see it in children. If you look at the nostrils, you see them trying to increase to take in air. Intercostal retractions, when they breathe, you can see their intercostal muscles. Okay. Accessory muscle use, obviously. Paradoxical breathing. What's paradoxical breathing? When you breathe in, your diaphragm goes down, your abdomen is supposed to go out. And then when you breathe out, it happens in reverse. This is when you breathe in, your abdomen goes in. So it's the opposite. Okay? And any abnormal breathing. Grunting, gasping, whatever. كل هذه signs of dyspnea. طيب. Sudden onset of symptoms, usually acute coronary syndrome will give you shortness of breath, pulmonary embolism, anaphylaxis, كل هذا هتديكم short pneumothorax. Right? The gradual and progressive are usually asthma, okay, COPDers, acute cardiogenic pulmonary edema, non-acute, non-cardiogenic pulmonary edema. So what's an example of non-cardiogenic pulmonary edema? You can have pulmonary edema due to a dysfunction in the heart. This is acute cardiogenic. Acute non-cardiogenic.
Pulmonary effusion.
Hypertension, no.
Pulmonary effusion.
Pulmonary effusion, you mean pleural effusion?
Yeah, pleural.
No. Pleural effusion is a different entity. No. Non-cardiogenic pulmonary edema, this is pulmonary edema that develops with a healthy heart. So drugs can do it if you are, for example, الناس اللي يشربوا chlorix. Okay, they're at risk of developing pneumonitis and they get inflammatory infusion and pulmonary edema, but it's not because their heart is not pumping well, it's just simply because their lungs have been exposed to a chemical. Okay? وحنتكلم عن هذه الحاجة كمان في التوكسيكولوجي lecture. Pneumonia, guys, listen, please, I don't want side talk. If you have something to ask, just go ahead and ask. Otherwise, please don't talk. Come on, usually COB is associated with pain. Okay, they usually come complaining. عشان كده, please, when you see your patients and they tell you والله مكتوم. يعني ايه مكتوم؟ عندنا كلمة كتمة ترى it means like 7-8 different things. طيب, it could be chest pain, it could be shortness of breath, it could be depression, مكتئب, نفس ضايقة. طيب, طفشان, كل هذه اسمها كتمة. طيب, so please make sure you know what the hell the patient is saying. So acute coronary syndrome, PE, pneumothorax, كلها is associated with pain. You can have palpitation. طيب, usually arrhythmia, AF or SVT. You might have decreased level of consciousness. You might have fever. This is usually a sign of infection. Okay, but you have to pay attention to the associated factors because it will tell you what the problem probably is. هذا مو معناته إنه if you have palpitation and you will have an AF or an SVT. No, it just says that it could be a cause. Okay. Now, signs of upper airway obstruction. This is cut and paste from the airway lecture. Stridor, drooling, sniffing position. Right? Dysphonia, dysphagia. A lower airway obstruction. You have prolonged expiratory phase. I'm going to show you this later. Tripod stance. يعني
Or your hands are out.
This is tripod stance. Okay. Wheezing, hyperexpanded chest, use of accessory muscles, هذه كلها signs of lower airway obstruction. Good. So on the physical exam, you're looking for what in the head and neck? You're looking for pallor because maybe they're anemic, high JVP, which might indicate heart failure, lymph nodes, masses that encroach on the airway, asymmetric uvula. ايش حيديكم الجماعة اللي هنا؟ Hyperexpanded chest, use of accessory muscles, هذه كلها signs of lower airway obstruction. Good. So on the physical exam, you're looking for what in the head and neck? You're looking for pallor because maybe they're anemic, high JVP, which might indicate heart failure, lymph nodes, masses that encroach on the airway, asymmetric uvula. ايش حيديكم الجماعة اللي هناك؟ ايش حيديكم هذا؟ What will give you an asymmetric? What's a uvula? So if it's asymmetric, it's usually an abscess. Peritonsillar retropharyngeal abscess from a bad tonsil. What will give you an asymmetric? What's a uvula? So if it's asymmetric, it's usually an abscess. peritonsillar retropharyngeal abscess from a bad tonsillitis, for example. ياما أولاد بيكونوا بيلعبوا بالقلم، واحد يجي يدفهم, they stick themselves and they develop an abscess. طيب المشكلة إنه the space is really tight, so anything that's going to develop in there is going to push on the airway and it might close. طيب Ross spots هذه قلناها قبل كده. What's Ross spots? Who knows? بلاش. Where do you look for it? إيش هي؟ لا. Ross spots are discoloration in your iris. It's secondary to bacterial infective endocarditis. It's one of the signs of bacterial endocarditis. Chest, you look for the symmetry of the chest. You auscultate for the breath sounds, the wheezing, crackles. What's TVF? What's TVF? Tactile vocal parameters. Which is what?
I wouldn't say 99 or 44. I feel vibration in the intercostal.
You're supposed to have a clear channel from your vocal cords all the way to your chest wall. طيب تحطوا يدكم على المريض, say 99, not 44.
لا 44.
هم عملوها بالعربي عشان كده. طيب 99 99.
لا 99.
الصيني ايش تشين عادي ما anything that's going to cause the same tone. Okay? And if you have a decrease in the TVF somewhere, then probably this is a pneumonia. طبعا يا جماعة الكلام هذا كله كلام نظري. هذا من أيام ما كان لا في إكس رايز ولا في ألتراساوندز ولا في سي تيز ولا في أي حاجة, ما كان عندهم غير ستاتسكوب. كله كلام صراحة فارغ. بس unfortunately it's a new book. You have to learn it. You have to know it. Okay? يعني in 15 years in medicine, I don't really know the difference between dull and stony dull. It's really stupid. Okay? يعني والله أيوة على المريض, yes this is dull, وأجي أعمل نفس الشيء على الحجرة وإذا it's the same then it's stony dull. It's really stupid. But in any case, this is medical history. Right? So you have to kind of know it. هذا هم بيقولوا كده زي ايش اسمه Beck's triad. Beck's triad is the triad for cardiac tamponade. Muffled heart sound. I don't know what muffled means. كل heart sounds بالنسبة لي muffled. So يعني it's really anyway. Cardiac murmurs, important murmurs I have to know. Right? So MR, aortic regurg, and aortic stenosis. These are the three most important. I really don't care what's going on in the tricuspid valve. I really don't care what's going on in the pulmonic valve. Okay? هدول اللي حيدوا لك مشاكل مع البيشنت. طيب? Simply, and the majority are in the aortic. ليش؟ لأنه الأورta is the door to the rest of the body. Okay? So if you have a regurg or you have a stenosis there, it's a problem. Snap and click. طبعا كل الكلام هذا قلنا لكم. This is something academic. طيب أنا لو جبت لك 10 كارديولوجيست على one murmur كلهم حيختلف. لو جبت 10 murmurs certain cardiologist ومنهم 2 ولا 3 they're the same we just repeated them حيختلف مع نفسه. طيب فإنه اللي يجي يقول لك والله أنا سامع رامبل في آخر ربع ثانية من الكاردياك سايكل this is completely impractical. طيب S3 and S4, by the way, you can hear all of this on YouTube. طيب حطوا hard sounds هتلاقوا 700 فيديو 700 audio file. You can hear it until you go blue in the face, that's fine. S3 is something useful that you can actually use because it correlates very well with heart failure. If you can hear it, you hear it with the bell. You don't hear it with the diaphragm of the stethoscope. Okay? How you do that in a really busy emergency room, it's a challenge. Abdomen-wise, is the patient pregnant? It's very, very important because the pregnancy itself could be causing the shortness of breath, organomegaly, endospleen down to his lower iliac fossa, positive hepatojugular reflux, which is just another way of saying heart failure. ايش بكم كلكم ماشيين يعني مرة ما هو interesting topic. Right, splitting edema, which is a sign of heart failure, clubbing, infective endocarditis signs, skin, either warm or cold. Diaphoresis is a very, very worrisome sign. If your patient is sweating, then you should be sweating. Okay? It's a sign of hypersympathetic activity. وطبعا signs of IV drug abuse, needle marks. ليش؟ لأنه this again will give you bacterial endocarditis وvalvular heart disease. Okay. كلام عامي وهذا خلصنا. We'll go into the diseases. Bronchial asthma is one of the most common diseases you will see. There's no way that you can get into any residency program or pass any board without being asked about this. And this again will give you bacterial endocarditis وvalvular heart disease. Okay. كلام عامي وهذا خلصنا. We'll go into the diseases. Bronchial asthma is one of the most common diseases you will see. There's no way that you can get into any residency program or pass any board without being asked about this. حتى لو you're going to go into obs and gynae, you're going to go into ophthalmology, you will have a patient who's asthmatic at some point in time. So you have to know what it is and what you have to give it and what you're not supposed to give it. Okay? So, anybody who can define bronchial asthma?
Chronic inflammatory disease with spasm.
With spasm.
Inflammatory ايه؟ plus
إيش
spasm
يعني؟
يعني.
كده؟
Bronchospasm.
Right. What else? You're right. Yeah, okay. So it's a chronic inflammatory disease of the airways. طيب. It has an element of spasm, it has some coughing, it has some inflammation, it has some sputum production, كل الكلام هذا. Do you think that asthma is reversible?
No.
Reversible.
Reversible.
Yes.
Irreversible.
Irreversible. Chronic
Irreversible?
reversible.
مين يقول reversible؟
احطه اول حاجه على فنتولين اذا اتحسن يبقى هو reversible.
إذا اتحسن reversible. Asthma, guys, listen. Asthma in general is not reversible. It has a reversible component, yes, but asthma is not reversible. Asthma starts with bronchoconstriction. This is a reaction to an allergen. A reaction to perfume. Guys, please, no talking. Right? A reaction to a perfume, a reaction to smoke, to some allergen, to dust. What happens is you get edema and you get mucus plugging. And with that, you have an increase in goblet cells because this happens over and over and over and over and over and over. Eventually, you get bronchial muscle hypertrophy and you get airway remodeling. Now, this is irreversible. You cannot reverse this. As you go down the list, the irreversibility dies off. So you can see the guy who's asthmatic, you can hear him coming 10 meters away. He's on 5 different inhalers. He's on steroids. He's been admitted twice before, went into ICU 3-4 times. This guy will die with asthma. This is the part that's reversible, fine, the constriction. Right? But it depends how much of your acute attack is due to this. The majority is due to edema or the mucus or other, it's not that reversible. Okay? Okay, so respiratory pattern. this is the normal respiratory pattern. You involve your entire muscle and you spend energy to raise your rib cage, lower your diaphragm, get your diameter bigger so that you can create a negative pressure, and you suck air in. Then you let everything go and everything recoils and you get air out. As you can see that the inspiration takes a long time, and expiration, the majority of the air, 80 to 90%, leaves your lungs within the first second. Now, if you have an equal time to expire, then you have an abnormal breathing pattern, and this is what asthma is. So you take, you need time to get the whole thing out. Okay? The fact that you can get it out, that means that your airways are open. Okay? This is how you diagnose asthma. It's not by wheezing. Okay? It just so happens that when you have a constriction and you're blowing air into it, then you make a sound. Hina, this is how you diagnose it. Not every asthma wheezes, and not everything that wheezes is asthma. This is how you diagnose it. You're listening with your stethoscope for the difference in timing between inspiration and expiration. If they're equal or nearly equal, then you have an expiratory problem. If they're not, then you're fine. Whatever is wheezing is something else. Okay? So now, what triggers asthma? Come on, this is one of the questions where whatever you say is going to be right. So, smoking, perfume, dust, everything. Right? Upper respiratory tract infection, allergies to foods, to drugs, irritants such as smoke and perfume, the cold. ناس تقول لك والله, yeah, I only have asthma when I go to London. Okay? Exercise asthma. You get it 10 minutes after you're done with your exercise, not while you're in your exercise. Gastroesophageal reflux, because you get micro aspiration. Okay? If you're using beta blockers. واحدة عندها acute angle closure glaucoma. They give her timolol, which is a beta blocker. It can push her into asthma. Aspirin-induced asthma is really, really a nasty, nasty asthma. Okay? NSAIDs, Voltaren. Okay? Menstruation is a trigger for asthma. Very unlucky girl. Every time she has her period, she goes into asthma. لا في ألعن من هذا لسه. Emotional. الناس اللي خسروا فلوسهم في 2006 في البورصة, this is what they present with. Okay? So now, what are the clues that are going to tell me that this is probably asthma and it's not something else? Okay. هم actually having a previous history. والله واحد بيقول لك أنا asthmatic, I know. Okay. Already on bronchodilators, right? Wheezing. هذا مو معناه إنه it is. This just pulls you more towards asthma. Okay. And usually it's a young patient. There's no such thing really as bronchial asthma in the elderly, unless they decide